Any further questions? All in favor, please signify by saying aye. Aye. All opposed? Thank you, Senator Berger.
Thank you, Mr. Chairman. Members of the committee, thank you.
We're going to take a brief recess to go ahead and get that dashboard up. Session. So we're waiting on some things from bill drafting. So in the meantime, we're going to take our most favorite senators and have them go first. And so Senator Evercash we're going to bring before us HB 56, and without objection, we'll bring the PCS before the committee. And Senator Evercash will be presenting.
So this is the UNC enrollment and growth funding. We've already done this for the community college system and the K through 12, and I would encourage your support for it. Thank you.
Since we don't have the dashboard up just yet, does anyone have any questions from the committee on the enrollment funding for Senator Evercash? Is there anyone from the audience that wishes to speak? Is there a motion? Senator Rabin moves unfavorable as the original bill, favorable as to the Senate Appropriations-based Budget Committee substitute with leave for staff to make technical and conforming changes. All in favor, please say aye. Aye. All opposed, nay. The ayes have it. And thank you very much, Senator Evercash.
Thank you, sir.
Is it up? Thank you. The next bill before us will be HB 192, and without objection, the PCS will be before the committee. Senator Amy Gailey is presenting, and I'm told that the dashboard is now up. Senator Gailey.
Thank you, Mr. Chairman. This bill has two provisions. The first part is to prohibit Planned Parenthood from participating in Medicaid. We have done a lot in the General Assembly in recent years to curtail state funds that go to Planned Parenthood, but there was still $830,000 which was available through Medicaid to be appropriated. It was done through, I don't think it was directly appropriated, but they were allowed to bid for work. And this would close that loophole since the big, beautiful bill that was enacted by Congress that made that available for us to close this final loophole. And then the second part of the bill is the greater fairness in billing and collections practices for hospitals and ambulatory surgical facilities. This would require give a patient a right to a good faith estimate from a healthcare provider, so that for a shoppable service, which I believe is defined through CMS, then a patient would be able to get a good faith estimate for that service and know what they would be expected to pay, so that they can do their due diligence if they so choose to make the most of their health care dollars.
Thank you, Senator Gailey. Any questions from the committee?
Senator Lee, I believe
Senator
the
Meyer?
PCSs are still not showing up on the dashboard, which may be why IT staff is up here.
Let's take just a brief recess. I'm going to run down my list. Michaela Liari is the name I have, and we have 2 minutes. So, and after that will be Kristen Howard.
Thank you. Hello, my name is Michaela Catherine Liari. I will be going back to my name Barnes. I would like to say that I am a 14th generation North Carolinian. My family on both sides has been here since 1660. They have fought in the American Revolution, they have fought in the Confederacy, they've fought at the Alamo, they've been a famous actor. With that, I can tell you that my family has done wrong. They have done great things and they have done wrong. I have grown up poor. I have grown up and I have been a first-generation student. I've done everything right, and yet I am going through a divorce right now in a domestic violence situation where the only option that I had was Planned Parenthood. Planned Parenthood, Medicaid does not fund abortions. Medicaid is used to give life-saving health care to people who cannot afford it. So if you take this away, I ask you, what are you going to do to make sure that health care is available to everyone? I am just like you. I was born in Dunn, North Carolina. I lived in the same house for 18 years. I paid for my way through NC State. I am you. I am everyone around you. Why are we doing this? This is not North Carolina. This is not who we are. We are here to support women. We are here to make sure that everyone feels that they are the same as others, and that is not true. I am so tired of white men speaking for me. I have grew up in a time where I know who I am. I am from here. I would like to know how many of you are 14th generation. How many of you can say that you knew you did the wrong thing by your ancestors and you're trying to make it right? Do not pass this bill. Think about others. Thank you.
Kristen Howard. Kristen Howard. If we can kind of keep the applause, we've really got to move through.
I'm Kristen Howard. I'm with Democracy Out Loud. And I'm concerned about the healthcare deserts in North Carolina. H192 on page 9, line 38, shows a cut of $19.3 million from Medicaid. We already have the federal cuts, and now the state is cutting as well. What about all of the rural hospital closures, the centralization of services, and the lack of doctors in counties? There are 26 counties that do not have an OBGYN. Planned Parenthood fills that gap for many rural women. Even here in the Piedmont Triad, Stokes County is considered a maternity care desert. I had 3 kids in 3.5 years. I spent a lot of time at the OBGYN. And what are these women going to do if they want to have children? Please consider voting against this cut. There are longer travel times for prenatal and gynecological care, higher rates of infant and maternal mortality, which is already the worst in the country, and higher rates of inadequate prenatal care. Thank you for listening to me.
And Morgan, I'm sorry if I get your last name right, Pixar, is it? Pixar.
Yes, I'm Morgan Pixa, and I'd like to also speak on behalf of Planned Parenthood. I had an urgent medical issue that my primary care doctor was not able to assist me with in a timely manner. My options were go to a hospital and go to ER, or go to Planned Parenthood. They were able to assist me in under an hour. They were kind, supportive, understanding, gave me the health care I needed, and I am male, and they were able to help me too. It does not just affect certain people, it affects everyone. Removing this funding will dramatically affect everyone's access to health care, regardless of who they are, how they were born, or what services they're providing. This is essential health care that provides urgent needs to every community. I live in Durham. I came to the Raleigh Planned Parenthood. They provided me with a service that my primary care doctor could not provide. It's essential health care. Please consider not removing that funding. Thank you.
Thank you. The next 2 speakers, Khalib Thomas, DeThomas will be up first, and then Maggie Michaels after that.
Hello, I'm Khalil D. Thomas. I'm with Democracy Out Loud, a local indivisible group, and I'm speaking in favor of Planned Parenthood. I'm a local business owner. I own 2 businesses. I'm a member of this community that contributes, but I didn't start out that way. I was a young single mom when I was in college. Planned Parenthood was my only means of having GYN care. There are many people who don't have the means to get health care and adequate health care without the services of Planned Parenthood. And I would like to ask all of you who are considering voting for this rider to the bill, or whatever it's called, why are you not taking into account the interests of your constituents who don't have the means to go to, a regular doctor's office? Why don't you care about the poorer constituents in your districts? You know, is it because they can't fund your campaigns? Why don't you care about us? This is just immoral. You know, as the Reverend Barber says, budgets are moral documents. Taking away health care from impoverished residents of North Carolina is not a moral choice. And I'd like to reference the big bad bill that Congress passed that is estimated to affect 670,000 North Carolinian residents. That's a lot of people who are going to lose health care if the Medicaid cuts go into effect as planned in 2028 or 2027. That's a lot of people who need Planned Parenthood and programs like this. I urge you to do the moral thing and not vote for this. Thank you.
Thank you. The next person up is Maggie Michaels.
Okay, I'm Maggie Michaels, and I'm with Planned Parenthood. Okay, where will these women go? Where will they go? Cutting funding is devastating to our most vulnerable neighbors. It does not stop cancer or infections. It kills women. Where's our morality? What is happening to us? We aren't taking care of each other at all. You know, these are our most vulnerable community members that can barely take care of, pay the bills, right? Like, where is our humanity?
Helen Wolfson, and then Paige Johnson.
My name's Helen Wolfson. I'm a citizen of North Carolina. This bill would prevent Planned Parenthood from participating in the Medicaid program in the future, even if the federal ban is lifted. Why? The bill's sponsors believe that the fact that abortion services make up a whopping 4% of Planned Parenthood's provided health services means that the clinics should be denied all federal and state funds, which already cannot be used for abortion services except in cases of incest, rape, or the mother's life being threatened. 1 in 3 Americans, myself included, American women, have gone to a Planned Parenthood clinic for services, mainly for things like contraception, testing and treatment for sexually transmitted disease, gynecological services, pregnancy tests. Planned Parenthood clinics are an essential part of the reproductive landscape, and in many cases, the only reasonable option in a reasonable radius. Yet this bill would deprive many women of health care. I haven't heard the debate about this bill yet, but I've listened to earlier debates within this body when considering restrictions to abortion. Members on both sides of the aisle told stories about their struggle with abortion, their appeals to God for guidance, and their very different decisions based on divine guidance. I believe this bill would be supported by religious arguments as well. Healthcare policy should be based on evidence and should aim to take care of and support pregnant people in the decisions they make. This body is happy to send my tax dollars in the form of opportunity scholarships to religious schools that teach a doctrine I don't embrace. This body is happy to send tax dollars to religious schools that would refuse to accept members of my family if they lived in North Carolina. This body is happy to send my tax dollars to unregulated pregnancy centers, most of which are connected to national religious organizations. But for largely, if not entirely religious reasons, this body does not want to send my tax dollars to a medical clinic that provides reproductive health care to those in need. Your powers as a legislator do not include the right to impose your religion on your fellow citizens. If you think it's wrong to fund abortions, don't donate to organizations that provide them. Encourage your friends and family not to have one, but don't impose your religion on me. Thank you.
Paige Johnson.
Certainly. Good afternoon. I'm Paige Johnson, President and CEO of Planned Parenthood South Atlantic. I want to make it crystal clear that this bill is about playing politics. It is a distraction to call this a defunding bill. It is about taking health care away from the people who need it. North Carolinians who depend on Medicaid will lose access to affordable reproductive health care, including access to birth control, cancer screenings, and treatment for STIs. Planned Parenthood South Atlantic proudly provides care to patients with Medicaid from 99 of North Carolina's 100 counties. And we will continue to provide care to the people who need us, no matter what. House Bill 192 simply means that cancers will go undetected, STIs will go untreated, and people will not be able to get the birth control they need to plan their families and their futures, and this will be on you.
I have one more name on the list, but it doesn't say on what topic. So, Wendy Missioner. Sorry about that. Thank you.
I'm Wendy Missioner. I belong to Chapel Hill Friends Meeting in Chapel Hill. I actually belong to a long list of groups, but what I want to speak to is the people here who are Christian, who honor Jesus. I want to remind you that Jesus very specifically said that it is the least of these that he will judge you by. How you treat the least of these is how he is going to judge you. Perhaps you don't believe that. Perhaps you think somebody made it up. But all of the stories of Jesus affirm those words. Thank you.
Thank you. That's the last of our speakers, and now we're going to come back to the committee since we were waiting for the bills to come up.
Mr. Chairman?
Yes.
If I
Senator
may,
Gailey?
with the chairman's allowance, if I may kind of furnish her with some additional information. My original presentation was pretty short because I know we're short on time, but I think that before the committee further deliberates, there's more information that I should bring forth. First, this is not a cut to Medicaid. This is changing who is allowed to be a provider of certain services. These would be family planning services that it can include reproductive preventative health, contraceptive services, screening and testing for sexually transmitted infections. It is not a cut. It just changes who is allowed to contract with the state to provide these services, which I believe, as a former county commissioner, all of these services are also available through your county health department. So in each of the 100 counties, there should be availability through the county health department for folks to go for these family planning services if they so choose. So there's no cut to the state budget. There is a change in who is allowed to bid for the services, and the availability of these types of services to the citizens of North Carolina is not changed.
Thank you, Senator Gailey. And any questions or comments from the committee? Senator Applewhite.
Thank you, Senator Lee. Senator Gailey, thank you for that clarification, because it strikes to the point of what I wanted to say. I recently had a meeting with our director of the health department, and unfortunately, Cumberland County ranks 19th in the nation in terms of STIs. Part of the reason is that we have several universities, the largest military installation in the country. And the director of the Department of Health, her hands are full. She can't, there's just not enough services in Cumberland County. So to go back to your clarification, we do have a Planned Parenthood down near the mall in Fayetteville. Does this mean that Planned Parenthood in Fayetteville would no longer be able to supplement the Department of Health's effort to address this epidemic of STIs in our county?
Senator Gailey, if you know.
My understanding is that under the bill, Planned Parenthood would no longer be able to receive Medicaid funds to provide those services. That doesn't keep them from providing them using other funds.
Are there any other questions or comments from the committee? Senator Morrow.
Yes, just wanted to make a comment. Thank you, Senator Gailey, for the clarification. I'm still concerned that this is a measure that will take health care away. And say this as someone that lived in Asheville for about 5 years. And there were many times where I was unable to get an appointment with my OBGYN, and I utilized my local Planned Parenthood clinic for all sorts of things. And we have mentioned rising rates of STIs, and even with cervical cancer screenings, that is something that also is on the rise with young people for various reasons. And there's just so much care that's provided at folks' local Planned Parenthood. Again, they provide affordable reproductive health care, including access to birth control and those cancer screenings. And they're also located in other areas throughout these communities. And so as someone that has utilized these services when, to put a final point on it, had a 2 to 3 month wait with my local OBGYN, and it's worse now. This was over 10 years ago when I lived out west, but particularly for areas that don't have as many healthcare providers that they need, Planned Parenthood is filling in critical gaps so that these women can get the reproductive health care that they need. So just wanted to make that comment that as we are losing funding for Medicaid as a whole, we're going to have a lot of folks that are going to need care that will be greatly impacted by this measure.
Any further question? Senator Waddell.
Yes, thank you very much. I looked at the bill, even though the information, the PCS came late, so I didn't have an opportunity to talk with those in Mecklenburg who will be directly affected. My question to you is, when does this take place? Because we've already referred, several of the community agencies that I've been working with have already referred at least 10 people for previous services. So these ladies will be in limbo and disappointed now that these changes are taking place. So is there a period where you will extend it to cover those who are already in the loophole or those who are already on the list?
Senator Gailey.
My reading of the bill is that this becomes effective when it becomes law. When it becomes law, then the DHHS shall disenroll Planned Parenthood, discontinue any Medicaid contracts, engage other Medicaid providers to provide those services. I defer to staff to be sure that that's the correct reading of the bill.
This is Allison Rossi with Bill Drafting. I can answer that question if...
That would be great, thank you.
So this does become effective when it becomes law, which would mean on the day that the bill passes, DHHS would be required to disenroll Planned Parenthood and associated entities as Medicaid providers.
Thank you. Senator Grafstein.
Thank you, and I appreciate the shortness of time. Just 2 brief questions. One, Senator Gailey, is this a consensus bill with the House? Have they agreed to this bill as well?
Senator Gailey, if you know.
I don't know.
Okay,
so the answer to that.
Follow up.
Follow up.
So there hasn't been discussion with them as far as you know?
Senator Gailey.
I don't know.
Okay. My other question, and maybe this is, it doesn't matter what it is. So we've heard about, the fact that Medicaid does not pay for abortions, and that Planned Parenthood is providing these other Medicaid services like cancer screenings and birth control and so on. What's the reason why we don't want Planned Parenthood, or why the bill sponsors don't want Planned Parenthood providing those services?
Senator Gailey.
Well, the reason that I don't think that Planned Parenthood should be providing these services is because I think that they indoctrinate. I think that they use their money and pass it to support the general operation, that funds that come in through one door can be used to support operations that, contrary to state law, I think that I'm struggling to articulate my thoughts. I think that Planned Parenthood is not my personal opinion is that Planned Parenthood is not a good faith provider of healthcare services to women. And I think that they should not be receiving state funds in any way, shape, or form. That's my personal opinion.
Thank you.
Follow up?
Yeah, just brief follow up. Thank you, Senator Gailey. Obviously, we disagree on that point, but I just want to make sure we're clear. There's no sort of medical or other objection to the kinds of service, the quality of the service that Planned Parenthood provides with regard to cancer screenings and non-abortion type services.
Senator Gailey, if you know.
I don't know, I don't have personal knowledge of any concerns about that.
Okay, thanks so much.
Any other comments or questions from the committee? Seeing none, is there a motion? Oh, Senator Heiss. Unfavorable as to the original bill, favorable as to the Senate Appropriations-based Budget Committee substitute with leave for staff to make technical and informing changes. All in favor, please say aye.
Aye.
All opposed, say nay. The ayes have it. Thank you very much, Senator Gailey. Next up, we will have HB 358. Without objection, we're going to bring this PCS before the committee, and Senator Heiss is presenting. Senator Heiss.
Thank you, Mr. Chairman, members of the committee. I'll go through these hopefully quickly. There are several provisions that are part of this bill. Most in the beginning, there's a chunk of them that deal with Tropical Depression Chantal, and as well as the FEMA designation from the Trump administration. This pulls up the state funds for the matching requirements, as well as the form of grants to individuals and families that are involved in that recovery. In Helene, it provides $2 million to the auditor's office to cover the cost of the relief dashboard they are directed to maintain. It provides $1.5 million to Warren Wilson College, a private college in Swannanoa, for the recovery efforts, and provides an additional $1 million to UNC Asheville for repairs. They were tied up with the North Carolina Arboretum in the previous, and this and had to move some of their funds to the Arboretum, so this makes them whole again, which is not part of their campus, regardless of the location. There's several technical corrections that recognize the Commission for Public Health Education as an accrediting agency. $1.1 million for the new cooperative innovative high schools, and $1.2 million divided between the Moorhead School for the blind, the Eastern North Carolina School for the deaf, and the North Carolina School for the deaf to cover administrative costs of these schools as independent agencies. The General Assembly is reinstating, well, we never cut it off, but the tuition grants for NCSSM students, as well as the North Carolina School of the Arts. In the kind of continuing budget, it didn't include the new graduates from Morganton and kind of watered down those funds that made the full payment for the first semester. So there was going to be a significant cut coming in January if we didn't get these $2.8 million there. This bill includes a provision allowing DOL to maintain private counsel, similar to other state agencies. Allocates $650,000 for 3 attorney positions, and $150,000 for security at the labor building. The bill requires DOA to assign 2 additional floors in the Albemarle building to the state auditor. There's a number of economic development incentives that are now a part of this bill. The Centennial Authority for Public Infrastructure improvements around the Lenovo Center Arena area, which is state-owned land. Next is $51 million appropriation for construction of a public barge and roadway in Hartford County in the event Department of Commerce enters into an agreement with an eligible business to invest at least $974 million of private funds for the project. The agreement includes a clawback if they don't meet those criteria, and it also amends the transformative JDIG to allow flexibility in the base period requirements. It appropriates funds from our SCIF fund for the fiscal year for the Global Trans Park, as well as $5 million for UNC Pembroke's Regional Emergency Response Center and $1.5 million to State Highway Patrol for repairs and renovations. The bill allows North Carolina Central University to sell the Chancellor's residence, which has fallen into disrepair, and to keep the proceeds for the sole purpose of purchasing another residence for the Chancellor. In the transportation section, the bill authorizes $750,000 in each year of the biennium, Division of Aviation for the RDU Airport Authority for costs associated with expanding a non-stop service to Dublin, Ireland. Provides $3.6 million to Tri-County Airport for hangar improvements. This allowed them to draw down federal funds. The bill appropriates $10.4 million to the Coastal Carolina Regional Airport in Craven County for site improvement and infrastructure needs for the airport. Allow them to lend in a long-term agreement with the tenant at that point. I think that covers the provision. Several things are cut into several bills, but covers the provisions that are in this bill.
Thank you, Senator Heiss. Are there any questions from the committee?
Senator Lee.
Senator Meyer.
Thank you, Senator Lee. Thank you, Senator Heiss. I do have 2 questions. There's a lot of great things in this bill. A lot of things that might go into an actual budget, but there's a lot of great things in this bill, and thank you in particular for the Chantal Fund and getting things moving there. I do have 2 questions for you, Senator Heiss. One, on the Albemarle Building office space, who's losing space to the auditor? What department does this hurt?
Senator Heiss.
Actually, the decision for that's left up to OSBM. They just are to sign additional to the auditor. We didn't. The bill did not specify which 2 floors would meet that criteria.
Well, I would
follow up, Senator Meyer.
I would hate to be in OSBM shoes. I have a second question related to the provision giving the legal counsel permission. Once this goes into effect, which of our Council of State departments would have the ability to seek their own legal counsel outside of the Attorney General's service, and which would not?
Senator Heiss, if you know.
I do not. That would have to be a staff question that goes beyond what I prepared for the bill. But
if there's not
a happens to know off the top of their head over the years which ones we've authorized and which ones we haven't.
If no one knows off
elections is, I know. I wouldn't attempt to dive into the complete list. I'm sure we can get it for you.
Senator Meyer, if no one from staff knows off the top of their head, we'll get you that information, Senator Meyer, so you have that this afternoon.
I'm sure there's an enterprising reporter out there who would like to report on it. Thank you.
Any other questions, comments? Senator Grafstein.
Thank you, Mr. Chair. Just a quick question. Is this a consensus bill with the House? Have they approved these provisions or agreed to them?
Senator Heiss, if you know.
I would be hard pressed to claim, given the negotiations, anything. I feel very positive about the future of this particular bill.
Thank you, Senator Heiss.
Follow up? No. Any other questions from the committee? If is there a motion? Senator Mergen. Unfavorable as to the original bill, favorable as to the Senate Appropriations-based Budget Committee substitute with leave for staff to make technical and conforming changes. All in favor, please signify by saying aye. Aye. All opposed, nay. And the ayes have it. Thank you, Senator Heiss. Senator Heiss, you were originally planning to go next, but because we're going to be losing some staff to rules, we've been asked to switch things up. So Senator Britt, if you wouldn't mind, we are going to, without objection, bring HB 307, ERNA's law. All right. Just one quick second. Stand corrected. We are getting the PCS from Jay with an amendment, and Senator Britt, are you prepared to go ahead and present that? I think they're just getting it up on the dashboard, but if you want to go ahead and explain it. So it came from Judiciary. So if those of you were there, there was an amendment in J that added an appropriation, and so it's here before us. I'm going to let Senator Britt explain what's going on.
There was
Clearly,
not,
I don't.
Yeah, thank you, Mr. Chairman. There was not an amendment in J that added an appropriation. There was already appropriation in there. The appropriation that's in there, and the only part that's for this committee, was the appropriation for the 10 ADAs and 5 victim witness coordinators in Mecklenburg County. And appreciate your support.
Any questions from the committee as to the appropriation? Senator Sori makes a motion for unfavorable as to the original. Give me just a second. Which one are we on now? Favorable is the Senate Judiciary Committee substitute as amended with amendments to be rolled into a new PCS and with leave for staff to make technical and conforming changes. Thank you, Senator Sori. All in favor, please say aye. Aye. All opposed, no. The ayes have it. And next we'll be moving to HB 268. Without objection, the PCS will be before you. Senator Heiss has volunteered.
Thank you, Mr. Chairman. I'll first explain the bill and then have an amendment going through. This bill makes changes in our capital portion of the vote, project authorization for 2 state highway patrol SCIF projects and the State Highway Patrol Auditorium and Training Center. Allows those authorizations to go through. It also appropriates this fiscal year funding for the projects and appropriates authorized SCIF funding for the NC State Veterinarian School. That's what I have in the bill, but I also have an amendment. Send forth an amendment.
Send forth your amendment. Would you like to explain the amendment, Senator Heiss?
Can. A couple adds I think several members have talked about, and we feel good about this. We'll add $100 million in dedicated repair and renovation funds for NC Central, provides 2526 authorized SCIF funding for NC Central's Dent Building and A&T's Health and Human Services Building. It also provides the SBI with some funding, $1 million for Viper radios, $1 million for replacement cars, and $3 million from the IT reserve for a case management system.
Thanks, Senator Heiss. Any questions on the amendment? Any comments? All in favor of the amendment, please signify by saying aye. Aye. All opposed, nay. The amendment passes, and now the bill's back before us. Senator Heiss, any additional?
No additional comments. Appreciate your support.
We have a motion from Senator Jarvis, but Senator Grafstein, you have a question or comment?
Just a question. Thank you, Mr. Chair. Senator Heiss, is this a sort of a consensus bill with the House? In other words, are you expecting it to pass the House tomorrow?
Senator Heiss, if you know.
I expect all these bills to pass the House because I assume they will be logical in that understanding. But I have no specific agreement with members of the House regarding this bill.
Follow up, Senator Grafstein?
I think you answered my technical follow-up of yes. Thank you. It sounds like there is a specific agreement on this one, but maybe not on others. Is that fair?
Senator Heiss, if you...
I have nothing specific from House members other than those who tell me they support specific provisions.
Got it. Thank you.
Thank you. Any further questions or comments? Is there, and Senator Jarvis made a motion, unfavorable as to the original bill, favorable as to the Senate Appropriations-Based Budget Committee substitute as amended to be rolled into a new PCS and with leave for staff to make technical and conforming changes. All in favor, please signify by saying aye. Aye. All opposed, nay. The ayes have it. And we are going to move on to H389. And without objection, the PCS is before the committee. Senator Heiss.
Thank you again, members of the committee. There's a few more provisions. In this one, I'll go through very briefly. These are kind of some of the time-sensitive things we need to finish. I'll begin in the HHS budget. This is $12.2 million recurring to the Transitions for Community Living Initiative, which is actually we're under a settlement with the DOJ that we would do this. That's not yet been passed. It will continue the funding of electronic health records at state operating facilities, and will give $30 million non-recurring to continue the Healthy Opportunities pilot program in existing pilot counties. There's a provision requiring collaboration between relative state agencies on applications for funding through the Rural Health Transformation Program that's established by the Big Beautiful Bill Act. Within the Agner budget, this provides funds to operate various state parks, museums, historic sites, including 54 positions and operating costs with the new Asia complex at the North Carolina Zoo. It authorizes and provides funding for the Environmental Management Commission to employ independent staff. There's provision that allows a company through 1NC to enter into an agreement to recover the lesser of 50% or $50 million related to water and wastewater improvements. Must reduce waste. This will require an investment of at least $2 billion and create at least 500 jobs. Also, substance allowance for members of the Utilities Commission. From the JPS budget, there is replacement and stabilization of the IBIS system, which is the Budget Planning and Development and Execution System. Finally, system, which is the Budget Planning and Development and Execution System. Finally, it provides $4 million non-recurring each year for marine vessel maintenance and repairs to shipyards to meet the U.S. Coast Guard's dry dock requirements. That's the portions that are within the bill. I actually find no controversy in any of the individual provisions, but do have an amendment as well to this bill.
Thank you. Please bring forward your amendment. I believe it's on the dashboard. Senator Heiss.
Thank you, Mr. Chairman. This would also provide $25 million to help local sheriffs cover the costs for mental health evaluations, $20 million in non-recurring over the biennium for EDP&C for business marketing, $20 million non-recurring in the biennium for EDP&C for travel and tourism marketing, and $2.1 million recurring for UNC Charlotte's data science and battery engineering and recycling initiatives. So,
the amendments before us. Any questions or comments? Senator Applewhite.
Thank you, Senator Lee. Senator Heiss, your amendment mentioned the additional $25 million for sheriffs to deal with mental health, and I literally just met with our sheriff. How is that divvied up or allocated throughout the counties?
The one I would say specifically, I know there's a formula for them, but it deals with the number, I believe it follows the number of evaluations they have done and provides funds to each of the sheriffs for doing the evaluation, for providing the evaluations.
Based on what?
Follow up.
Follow up, thank you. So would it be like a look back on what they have historically done?
Senator Heiss.
I don't believe this specifically states to it, but somebody may be able to pull up.
I think Senator Britt might be able to.
Yeah, so these grants will be worked on in conjunction with the Sheriff's Association. They will go to Tier 1 and Tier 2 counties, and the amount of dollars would be determined by the Sheriff's Association working with the sheriff's departments that are of greater need, that be used to assist with transportation of individuals to mental health evaluations, but also to provide for positions for mental health staff to do those evaluations at the jail as well.
Thank you.
Senator Britt, thank you. Any other questions or comments? Senator Grafstein. I think I know the question, but go ahead.
You're catching on, but I actually had a different specific question, Senator Heiss. Section 9.1, additional transparency in state budgeting, list requesting members of the General Assembly in the current Appropriations Act. It looks like this is a provision that would require that any appropriation or any provision would need to state what member or members requested that provision. And my first question is, who requested this provision?
Senator Heiss. If you know.
This was put together in a general concept from the chairman. If you'd like to put my name on it or any of the other chairmen, please feel free to do it, but it probably needs to be enacted before that goes into place. So.
Follow up, Senator Grafstein.
Of course. Thank you, Mr. Chair. So has the House agreed to this provision?
Senator Heiss, if you know.
I've had no conversations about that specific provision with any member of the House. The other provisions I've gone through, I've also had no objection from members of the House, but I have no agreement from their leadership or others that they will take this bill up.
I very much look forward. Thank you. Just the last comment. I very much look forward to this going into effect and having a good list of sponsors of different provisions of the budget. So thank you.
So if you would like that, continue to pressure the House for them to take this up.
I've got them on speed dial.
Okay.
Senator Lee.
Yes, Senator Meyer.
Thank you. Well, first on that matter, the Senator Grafstein just brought up, well, I'm happy to give Senator Heiss all the credit for introducing it here. As a former House member, I would call that the Honorable Verla Insco provision, since she introduced that just about every year in a budget amendment. But I actually wanted to speak to the Environmental Management Commission provision that's in this bill. The $700,000 there is, I believe, a waste of money, as we've debated previously when that's been introduced. The EMC gets adequate staffing services from Department of Environmental Quality. There's clearly better places that we could spend $700,000 these days, and I think that it actually is going to hurt things as we try and do environmental management, because it's going to create a bigger rift between EMC and the department and all the constituencies that we have to work with. So just problematic piece of this bill. Thank you.
Thank you, Senator Meyer. I think we're still on the amendment, though. Any other questions or comments on the amendment? All in favor of the amendment, please signify by saying aye.
Aye.
All opposed? And now we're back on the PCS. Is there any other discussion on the PCS? Is there a motion? Senator Britt. Unfavorable as to the original bill, favorable as to the Senate Appropriations-based Budget Committee substitute as amended to be rolled into a new PCS and with leave for staff to make technical and conforming changes. Thank you, Senator Britt. All in favor, please signify by saying aye. Aye. All opposed, nay. The ayes have it. Thank you, Senator Heiss.
No, I get to step in. And next up on the committee, we're going to have House Bill 562, and Senator Lee has prepared, and I believe it's a PCS.
Yes, sir.
And without objection, the PCS is before the committee. Thank you, Senator Lee.
Thank you, Senator Heiss. So this bill provides an additional $90 million in recurring for the Medicaid rebase, the amount that was recommended by the General Assembly's Nonpartisan Fiscal Research Division. I know that number may look familiar to a lot of y'all because that was the number we tried to move forward in July. As many of you know, when we passed the Senate bill, we had the FRD recommendation that changed between when we passed our budget, the House passed their budget, and we came back toward the end of July and passed kind of an immediate needs budget. We were not able to get the full amount of the FRD recommendation in our negotiations with the House, so we moved forward with what we could get. So this increases it by $90 million, and on top of the $690 to Medicaid, we also fund the administration costs, $42.2 million in recurring and $34.4 million in non-recurring this fiscal year to support the administration of the program. The bill also includes vacant position eliminations within the Department of Health and Human Services, funding source offsets and other reductions within DHHS to help right-size the department and offset some of the cost of the Medicaid program that seems to be kind of going up. As I just mentioned, it went up over just a few months, several different times. There's a provision and appropriation for $1 million included to require the auditor to examine Medicaid eligibility redetermination on the local level. It also requires DHHS to develop a plan for cost savings and efficiencies within the Medicaid program by engaging stakeholders, particularly with the prepaid health plans who have reached out to us on a number of recommendations that they felt like were not being heard. House Bill 562 also includes the latest round of funding for both NC Cares and NC Hospitals, which was established in the 23 budget, which I'll talk about a little bit more in just a second. The NC Care Initiative supports rural hospitals and helps establish 3 rural care centers. In 2023, we approved a total of $210 million worth of funding over the 3 years, and this 105 is sitting in a reserve that will be released. And the children's hospitals in a similar predicament, we agreed on it, not just agreed by a handshake, but agreed on it and authorized it in the bill from 2023, approving nearly $320 million over 3 years. This is the last $103.5 million toward that. And before I kind of get into some of that, I want to go ahead and introduce a technical amendment that I was led to believe we need to go ahead and do right now. So this is a technical fix to account for the DHHS vacant position eliminations, and I can probably rely on someone else to let me know what that is since I was handed this as I was standing up there.
Jennifer Hoffman with Fiscal Research. The bill requires DHHS to eliminate positions to achieve savings, but the bill doesn't speak to what happens with those savings. This amendment directs that it's a reduction to the department.
Questions or comments on the amendment?
Question, please.
Senator Batch.
Thank you. So just for clarification, so it's a reduction in the overhaul expenses, but there's no technical savings. Is it being categorized as just a cut, and so therefore that's how we're saving money, as it's just cutting it from the budget, from the Department of Health and Human Services budget? Is that correct?
I don't know. But my understanding is this is both a reduction that is reallocated, so the savings from the reduction are reallocated towards the amount of funds we're putting towards the additional rates.
Okay. Yeah. So, and follow up on that. So then it will be, so that money will always go back into the rebase from the reduction and not into the general fund. It'll be earmarked for, I mean, it goes in the general fund that we appropriate, but it will be earmarked for the rebase.
It will be part of the rebase funding, yes.
Thank you.
Any other questions, comments on the amendment? Seeing none, do we have a motion? Senator Corbin moves for approval of the amendment. All those in favor, please signify by saying aye. Aye. Opposed, no. The ayes have it, and the bill as amended is back before the committee.
Thank you, Mr. Chairman. So there's a number of things going on in this bill, and I just wanted to clarify, just not with technical language and all the other stuff, but it's really important that we fund this rebase number, not just the $690 million, but the administration costs that go along with it. It's incredibly important that we as a General Assembly live up to what we told the public about rural health care in North Carolina in 2023, where we committed to spend money for the benefit of our citizens all across the state, not just in our major metropolitan areas, through the NC Cares program. It's important, whether you agree with the Children's Hospital or not, it's important that we acknowledge, recognize, and live up to what we told the general public that we were going to do by authorizing these funds in the 2023 budget. All this money that has come in from the federal government has gone into the ARPA Temporary Savings Reserve, and these two projects were earmarked not by the Senate Pro Tem, not by Speaker Moore, not by me, not by anyone, but the General Assembly passed its bill authorizing these funds, and we now need to appropriate them to live up to what we told folks we were going to do. There are people relying on it, they've spent money on it, they've made plans on it, and we need to do it in addition to what we're doing in Medicaid. If you would like to know whether a children's hospital is necessary in North Carolina, come find me after this meeting, because I'm going to Cincinnati Children's in October for my 15th or 16th year, going there quite a bit, sometimes 7-8 times a year for my child's health care. It is vitally important. That's not what we're talking about today. We had that argument in 23 and we made that decision. And so those funds need to be appropriated now. So thank you, Mr. Chairman.
Thank you. Senator Robinson.
Just a clarification, does the additional funds meet the request of the Secretary in terms of earlier his, when he explained where the cuts would go, et cetera?
You want me to respond?
Please.
It is my understanding, conversations have been had with the governor and with the secretary. If these additional funds are passed, there will be no need for the cuts to provide.
Okay. Thank you.
Senator Corbin.
Thank you, Senator Hines. I just want to concur with Senator Lee. Folks, we voted almost unanimously to expand Medicaid to work in North Carolinians not too long ago. And I want to encourage the House to not only take this up, but to pass it. This is what we need to do. It's the right thing to do. And Senator Lee, thank you for your presentation. Just want to encourage my House colleagues, where I spent 4 years, Senator Meyer, over with those folks in the House to take this up and pass it. Let's do the right thing. Thank you.
Senator Applewhite.
Thank you. I have a question for the Senator Lee. I almost called you Sergeant. I'm sorry. It's a tough time.
They called a lot worse.
Senator Lee, I'm have some notes here, and I think you mentioned $1 million to the state auditor to look into Medicaid evaluation.
So the Mr. Chairman, I may. Redeterminations that are made on a local level, just to work with them and on how those redeterminations are being made.
Follow up? If I could ask, we have the understanding that all of our local counties are struggling in social services. They lack employment after COVID. People didn't come back, and it's just a hard time for everyone. With that understanding, if you could help me understand what the genesis for that is to have this audit done right now when we know that they are challenged. Why are we doing this?
So I think the idea is to actually go in and help the counties with the redetermination efforts to make sure it's still in the appropriate place if they're having that much of a challenge. I mean, that really is kind of the gist of it, since it's a statewide resource that we're funding. At the state level, we're trying to ask the auditor to go in and say, okay, we've heard some questions, statements, and issues with being able to keep up. And so that's one of the reasons why we're working on this.
Short follow-up? And so with that, once it comes back to the General Assembly, we would be positioned or at least give consideration to funding or how we might be able to support the county offices?
I can't speak for everyone else, but I think that's the idea, to find out is, do we need to support them? Do we need to assist them? And hopefully the auditor will be able to come back with a recommendation as to kind of what's going on. And I hate to say this because we're government, how can we help? But if there's a way we can assist in that vein.
Thank you, Senator Lee.
Senator Applewhite, just to add to that briefly, if members would like to find it, several years ago, State Auditor Beth Wood at the time picked 10 counties in the state and did an evaluation of their Medicaid determination. That audit finding was not positive for the potential of the state, and when we are looking down the risk of the state, if the federal government decides that that's a liability that is on the state, that we have to pay the feds back for all those, it would be catastrophic in billions of dollars just from those 10 counties. I couldn't imagine the entire state. And before those changes go into place, we have to get a system that is accurate and in place for Medicaid determinations. Senator Bergen.
Thank you, Mr. Chairman. And another thing that goes along with that is the SNAP and the error rate there, and we're going to have to deal with that. But on last week, I asked the secretary how many, because there's been a lot of conversation about the Children's Hospital, whether it's needed or not. And so I asked the secretary how many kids went out of state for hospital care. And here's his answer: probably somewhere in the neighborhood of 5,000 with North Carolina Medicaid. So I think that is a pretty good statement that and we don't know the other kids that go out of state. So we're going to try to find that out too from commercial. Thank you.
Senator Grafstein.
Thank you, Mr. Chair. Opposite question for you, Senator Lee. It's no secret that the House does not agree, right, with the way the Medicaid rebase is being done in this bill. I support the Children's Hospital. You've made a passionate and important case for it. And as you mentioned, many of us do. I guess I just want to implore you all, the hospital is not going to get its funding any faster if we don't fund the Medicaid rebase, if the House comes and goes tomorrow and nothing happens. I'm sure you've heard from folks too, people with disabilities are in a blind panic over this, and that was not an appropriate thing to say, but they're in a panic over this, rightly so, because, somebody who has Medicaid and once in a while they need to go to a doctor, they might feel maybe their doctor is not taking Medicaid anymore or something, but somebody who with a disability who relies on Medicaid day after day after day, they may lose their provider. Little providers are going to go out of business. These cuts are going to hurt them hard. And I guess I would just implore us to put aside these differences, because I understand where the passion comes from. I support it, but in this moment, what's really needed is a clean Medicaid bill, a rebase bill that we can get the House to agree to. And I just would ask us all to kind of turn the heat down a little bit and try to get to that place, because if we end this week without an agreement, we all know there are catastrophic consequences and no children's hospital. So I just would like us to rethink the approach here, and appreciate all your work on this.
Thank you. Any other comments? Questions? See if I have any text for an amendment. I'll try to come up with it. Anyone, is there a motion before the committee? Senator Bergen or Senator Gailey moves unfavorable as to the original bill, favorable as to the bill wasn't amended, was it? As amended, rolled into a new PCS. Would leave for staff to make technical informing changes with a referral to rules. So thank you, Senator Gailey, for that motion that's coming up. All those in favor, please signify by saying aye. Aye. Opposed, no. The ayes have it, and this this bill will be referred to the Committee on Rules, and I don't think there's anything else. Straight to the floor? Okay. We'll edit that and send this straight to the floor. So, anything else? Having exhausted the agenda with nothing else before the chairman, this committee stands adjourned.